adjusting to that curveball today as they rush to vaccinate as many people as possible.
And pause on using the J&J vaccine is forcing several clinics to change their plans at just a moment's notice. Julie DUNMIRE spoke with several local health organizations today about that. Julie, what are they saying?
Well, Janice, for starters, if there's one thing anybody takes away from this story today, it's that all the health experts I've talked to today say that there's been no direct link between the J&J vaccine specifically to those instances of blood clots in those 6 women, that's something that the FDA and the CDC is still looking into. But again, this causing quite the headache for many local health departments who have been allocated the Johnson & Johnson vaccine.
The one-dose shot to prevent COVID deaths put on the sidelines as Michigan is in the middle of a third surge of cases.
It's a challenge here at the local level.
Kalamazoo Public Health Department's Jim Rutherford saying taking Johnson & Johnson out of the rotation is a setback.
It's frustrating because when we had all 3 vaccines that were readily available, it's really the fuel that we need.
But health officials across West Michigan and hospital groups all say the same thing. Don't panic if you got the J&J shot.
But certainly we need to do a bit more review on it, a bit more analysis, and see what exactly is this blood clotting disorder that they're noting. Is it related to the vaccine, or is it maybe just an incidental finding not related to the vaccine?
This pause, they say, is a sign the vaccines are being watched carefully.
Every person in the country got this vaccine. If it's 1 in 1.1 million, so 300 people could conceivably get this complication if it's related at all. But now remember, we've had almost 600,000 people die from this virus.
There's probably been no vaccines that have been more scrutinized in the history of vaccine development than these particular vaccines.
Spectrum Health saying they've given roughly 4,000 doses.
To my knowledge, we have not seen any severe reactions.
Spectrum Health infectious disease doctor Liam Sullivan admits this will cause hesitancy, even though he himself got the J&J shot and had no issues like the vast majority of people. At the local level, it means a lot more logistical work.
We had a large clinic scheduled for Thursday of this week with about 3,500 doses of Johnson & Johnson.
In Kalamazoo, they're able to switch that clinic to entirely Pfizer. In Ottawa County,
so we've had just a little less than 2,000 doses of the Johnson & Johnson that were supposed to be administered. We have canceled those clinics at this time so we can find out, what we're able to do as far as providing an alternate vaccine, whether it's Pfizer or Moderna. One of the clinics was for students at GVSU, so we're working with the GVSU team over there with communications and the health center to make sure that we can have other options for those students.
It's a bump on the way to herd immunity. All the local health departments I spoke with saying they're hopeful experts will find these complications have nothing to do with the Johnson & Johnson vaccine at all.
6 people and nearly 7 million.
And the CDC is set to meet on this subject tomorrow, I believe. Also, I'm going to go ahead and mention, there's something, sorry about that. I'm going to also say that if you are experiencing symptoms if you've had the Johnson & Johnson vaccination in the last 21 days or so and are experiencing symptoms that they correlate with that, such as a headache or body aches, you're asked to call your doctor. DeVos Place has plenty of Moderna and Pfizer vaccines still available if you'd like to get one. Reporting live in Grand Rapids, Julie DUNMIRE, Fox 17 News.
All right, thank you for that, Julie. In Calhoun County, a walking